Well, good morning if you're on the uh, West Coast, and good afternoon if you're on the East Coast. Hello and welcome to the Health Literacy Solutions Center April webinar, our second webinar of the month. My name is Jennifer Pierce, and I will be moderating today. We thank you for joining us. Hope everyone is well and enduring as best as we all can. Before we begin, I want to cover just a few housekeeping tips. Audio is provided through your computer speakers. There is no dial-in option. All attendee microphones will be muted for the duration of the webinar, but please feel free to ask questions throughout the webinar using the chat box. And if you're not familiar, the chat box is found in the bottom right corner of your screen. To bring it up, simply hover near the bottom center of your screen and you'll see a little conversation bubble. If you click that conversation bubble, it will bring up the chat box. Your cursor will appear at the bottom right corner of the screen, and you can send chats to everyone, or if you're having some technical issues, you can send them directly to me, Jennifer Pierce, and we value your interaction, and I know our speakers want this to be very much a conversation and an interactive experience. So please get familiar with the chat function, and we want to hear from you. If you have any technical difficulties, you'll see there's an email address shown on the screen, email support@healthliteracysolutions.org. Again, support@healthliteracysolutions.org, and our technical support will try to work it out for you. Worst case, if something goes wrong during the webinar, please know this webinar will be recorded and will be posted in the Health Literacy Solutions Center webinar archives. So never fear, you will not miss it. In the event of technical difficulties, you'll be able to access the webinar and all of our previous webinars on the Health Literacy Solutions Center site. After the webinar, you'll receive an email with a link to an evaluation form. Please take a moment to provide your feedback. We value it. We are very interested in hearing if there are other topics you would like to see included in the webinar series. For those of you who signed up to receive CEU credits, you must submit a completed evaluation in order to receive your credits. So make sure that you keep an eye out for that email and do take the time to reply, particularly if you are looking to get CEU credits for today. With that, let's go ahead and get started. We'll transfer our slides over to our speakers. Please note you'll see the screen go blank here in a moment. Don't worry, we're simply transferring control over to the speakers. While that's happening, I will go ahead and speak a little bit about what we have in store today. As luck would have it, this is Patient Experience Week. As much as I would love to say we had planned this, it just happened to be the case, and how fortuitous. So today's webinar is Building Health Literate Care Through Meaningful Patient Engagement, so it's incredibly timely. Today we'll be hearing about the importance of directly engaging patients in your health literacy work, and that's truly best practice. We'll hear from the speakers about the benefits of working together with patients to plan health literate care, the various elements of patient engagement, including the domains in which it can be applied and associated enablers and approaches, and finally, methods for patient engagement that can be applied across healthcare settings. It is my pleasure to introduce today's speakers, Farah Schwartz and Kesari Skane. Farah is the manager of patient education and engagement at University Health Network, a multi-site hospital in Toronto, Ontario, where she uses her 10 years of health literacy experience to improve patient engagement in their care and wellness. Farah is also the lead of the Canadian Health Literacy and Patient Education Network, known as CHILPEN. Her co-presenter, Kessery, serves as the manager of patient experience and health improvement at University Health Network. And there she provides leadership within the patient engagement portfolio, focused on learning from patients and families by engaging them in organizational planning and decision making. In addition to working directly with patients and their families, she works with health professionals to support them in building their capacity to partner with patients and families. We are delighted to include their expertise as part of this webinar series. Farah and Kessery, I will now turn the presentation over to you.
Wonderful. Thank you so much, Jennifer. Just hoping everyone can hear me, because today we've certainly had the 3 M's of working from home hazards. We've had issues with megs or internet, mics, and certainly I already had meltdowns. And I know my kids are on lunch right now, so I can't promise that you won't hear anything else in the background. So
we can hear you just fine, of course. Go ahead.
Excellent. Thank you. Thanks, Jennifer. So thanks everyone for your patience today as we do this webinar. As Jennifer mentioned, we do hope to have some interactive elements and really just navigating the context. So thanks everyone so much for being here today. If we go to the next slide, Kessery, please. Jennifer mentioned that these are the goals of today's sessions, and we just wanted to really acknowledge that when we started out and planned this webinar in the first place, we were really in a different context, all of us were. And so while the goals have stayed the same for today, and we'll go over the same principles for the content, we've definitely shifted our focus within the content to try to include some real-time examples from COVID. And we also, Kessery will go a little more into detail about our setting and what that looks like, but we want to acknowledge from the start that we do our work in a multi-hospital health system. So while the principles of engagement definitely transfer to other health settings, what you'll hear from us today are more hospital type examples that we hope are very transferable to your setting too. Next slide, please. So today what we'll be talking about is, patient engagement and the health literacy work you do. And so we wanted to really distinguish here between engaging with patients in their own care and partnering with patients at the organizational level. So when we talk about engaging with patients in their own care, it means that patients as individuals or family units are involved in their care, their decisions, and their self-management. Shared decision making is a great example of someone being involved in their care. So it's a process in which providers and patients work together to select tests, treatments, management, or support packages. And engagement in care really requires that providers and patients recognize that a health decision is collaborative and really takes both available evidence and the patient's preferences on treatment decision into a care plan. And so a lot of the health literacy work that we all do really does involve engaging with patients so that they're able to be involved in that way. Today, we're shifting it a little bit, though, to looking at patients as partners in the organizational level. And so Kessery will talk a little bit more about some of the differences and what that means.
Thanks, Farah. And so, when we talk about engagement at the organizational level, we're really referring to how we're partnering with patients or family caregivers to work with us to help shape and create what care looks like. So this might be things like creating policies and procedures, and we look to really learn from their experiences, both where there have been positive ones, but also where we could be actually doing better. And so the idea here is about this mutual sharing of knowledge between providers, leaders, and patients, and really with a shared goal of improving the quality and safety of care. And I would say that one of the elements that we really require in this notion is that there's an authentic culture of understanding each person's role and that they have a unique expertise, including the expertise that patients and caregivers bring to the table. And so the idea is that if we can do this type of engagement at the organizational level and learn from our patients and families, it will in turn make a difference in how we engage with patients in their own care, which is what Farah just described ahead of that. So just going to take us to the next slide here. And so, within, I want to talk a little bit about just setting some context for the organization that Farah and I work with, which is University Health Network. And it's a hospital network in Toronto, Canada. We're a research and teaching hospital that consists of 4 hospitals with 10 different clinical programs that provides care from the acute phase all the way to rehab and out into the community. And so we have 2 acute care hospitals with emergency departments. We have a 3rd hospital that provides cancer care. And our 4th hospital provides rehabilitation care across 5 specialized programs, things like a brain program, spinal cord, cardiac, geriatric, and complex continuing care. So we're quite a big hospital system. And patients usually follow a journey across at least 2 of these sites, if not all of them, across the care journey. And we serve, Toronto proper, the Greater Toronto Area, which is areas that surround Toronto, and broader Ontario, as well as other provinces and territories, because we have some unique services that we provide. And so, as our portfolio that you see in front of you, we serve this entire health network. We have 5 different programs that provide support to these hospitals. And it's set up very much just like what Farah and I described in the previous slide, where we're actually engaging with patients in their personal care and health decisions, as well as at the organizational level. And so what you see is that our goal is to create more informed and activated patients and family population through respectful partnerships with our providers. And so we're really trying to encourage this culture of safety where we're all involved in the outcomes of care. And you'll see that at the top in the blue boxes, this is sort of the programs that we have that help support patients being engaged in their own care. So patient education and engagement, which is what is the program that Farah leads. And that's really focusing on how to build staff capacity and working with patients, as well as building tools and capacity in patients to engage in their own care. And this is really the health literacy component that we're focusing on today. We also have patient learning centers, which is really the physical places and now virtual places where patients and families go to get well-resourced and information in various ways. And so we have physical libraries at our sites. We have the MyUHN patient portal, and this is an online portal that provides patients and families with real-time access to their own health record and the support to engage in their record. And then we have patient engagement for healthcare improvement, which is the program I lead. And this is really what I described before, how we're learning from patients and families from their experiences and bringing them to the table to work with us. And then we have patient relations, which is where we receive concerns and compliments from patients and really help navigate patients with any concerns that they have about their care. And so you'll see in those gold boxes at the bottom, this is how we're learning from patients and the organization to help in quality improvement as we move forward. So together, these programs is really what enables healthcare providers to engage with their patients. And this is how we're set up in our organization. So Farah, I'm going to turn it to you.
Thank you. So while Kestari pulls up, you'll see questions in front of you, and Kestari is just going to pull up a poll. So we'll ask all of you to take, just give some thought to the questions in front of you. So, and we want to hear from all of you about how convinced you are that this is important work to do. So really engaging with patients in your organizational work beyond the direct care engagement. And then how confident you are about being able to do that. So we'll do it one at a time. So the first question there in front of you, if you could just give it thought, you have up to a minute, but we will close the poll earlier if we get answers from everyone. On a scale of 1 to 10, how convinced are you that it's important to engage patients and families in your health literacy work?
People are voting. This is awesome.
If everyone just gets their answers in, we'll definitely close it before that 1 minute time is up, because that's a long time for everyone to wait. Very fast.
Okay, we'll give it 5 more seconds. 3, 2, 1, closing. Okay. Okay, let's take a look here. You see that there?
Okay, wow. So that's great. So we see that quite a few people on the call are highly convinced that this is important work, and that's great. We also thought maybe you would be because you're taking your time today. And so of everyone who answered, we can see that you all have very high conviction that this is an important thing to do, and that's great. So we hope to be able to help you have more information about why it's so important and be able to move this forward in the future. So we're going to keep asking you a couple other questions. We want to know next about your confidence level. So you're a very convinced group that this is important, and then that's a very important thing to get started with. But how confident are you about actually doing the engagement? So if you could take the minute or less now to just quickly answer about your confidence level. Sorry, and we won't. We want to give you a minute to think about it, but also know that silence on a webinar isn't necessarily what people want to hear either. It's kind of like radio. uh,
Okay, I'm going to count you down for 10 seconds. Does that sound good?
sounds good. Or even a 5. And as far as the
5,
first.
4, 3, 2, 1. Okay, closing that up.
It's time for the big reveal. So apologies to the person who commented you couldn't hear anything because we just wanted to leave a bit of space for people to consider their answers. And so now we see that there is a bit more variation here. So, we have really quite a range. It's good to see that people do have some confidence in their skills. And we even have a few people who rated themselves as having the highest confidence at a 10, and that's great. But we do see more of a distribution. So although many of you are highly convinced that this is important, you don't have as high a confidence in how to do it. So we'll scratch the surface of that today. And of course, there's a lot to learn and a lot to do. We hope to give you some basic tools as to how to do this and how to get started, and then resources where you can go for more information as you go further in this work. So there is one more question that we want to ask you. So for those of you who were convinced that you should do this, and whatever your confidence level is, have you engaged patients in a project, initiative, or improvement in this way before? And so Kesari will just open up the question. And so as she does so, we'll try to avoid the silence again, and just say, sometimes people may actually try this and then it didn't go as they planned. So that could actually lead their confidence to be lower. Or perhaps you feel that you have a lot of those pieces in place already, but you've never tried it. So having a sense of who's actually done this engagement will give us a good sense as well. So if you could just take a very quick second to answer this question, and I think we'll start the countdown even earlier. So if you answer by 30, so that gives you another 3 seconds, 2, 1. And so let's see who in the room has engaged patients in their project, initiative, or improvement. Okay, so quite a few people have. A few people haven't, and a few are unsure, which is also fair because sometimes it can be hard to tell if something is direct engagement or if it's more of engagement and care, and then quite a few people didn't answer, and that's okay. So thank you for taking the time to give us a sense of who's in the virtual room, and it's helpful information, and we'll continue to build your confidence and get you ready to try it for the first time or keep going with what you've already been doing. Thanks, everybody.
Great. Okay, so as Farah, as was revealed here, it sounds like people really do believe that this is an important element to do. And just to give you a little background around, a little bit of context around the reason why this becomes so important is just to go over quickly sort of a cultural transformation that we've seen, I'd say in the last 15 years. We've noticed this transformation. We've gone from a system where patients have taken a sort of a passive role in their care, where they're managed by their healthcare team. They're totally trusting of the system to take care of them. And they're also expected to be patient. And as we learn what the actual word patient means, it actually means to suffer. And so we're really sometimes may have been causing harm or suffering for patients when it may not be needed. And so I would say as the political, economic, social landscape has changed recently, it's moved to patients actually being required to be more assertive, to manage their own care, to advocate for themselves, and maybe even becoming impatient And now we're trying to move toward what we talk about as sort of patient experience 2.0, where this is concept of partnership, where patients are respected and are also respectful. Their care is coordinated so that we're not building silos where they have to navigate between those and have problems within that. They're actually recognized for their own expertise and is integrated as a partner in their own care. And I would say that this transformation is happening in areas. The culture is shifting towards this patient experience 2.0 that we're talking about. But in the last couple of months, I would say we're quickly recognizing in our current COVID time that steps have been taken back around this, and more unilateral decisions are being made within one's own care as well as within the system, as we see the cancellation of treatments without discussion around that. Changes in visitor policies have occurred, and we're removing some, key care partners from the setting. And some of this, kind of has to happen, but how do we do this in the current landscape? And so even in the current time and the setting, we're still trying to integrate and collaborate with patients. It may not be perfect, but we're, I would say that we're really trying hard not to just shut people out around this. And so it becomes really important to think about how can we be innovative and still have this culture among us. And so you may have seen on Twitter, I would likely maybe say yes if you take a look at the number of likes and retweets on this slide, where patients are taking on that role of advocator and needing to manage their care. But they're received with doctors saying things like, don't confuse your Google search with my 6 years of medical school. And with patients responding with, don't confuse the 1 hour lecture you had on my condition with my 20 years of living with it. And so, this dynamic really doesn't help anyone, doesn't help the system, and it certainly doesn't help our patients and families. And so making space for that collaboration, I think, really helps to ensure that there's a respect in the relationship and that really everyone's contributions are valued around this. And so just a little bit more around why this becomes so important is that as we shift our discussion now to really engaging in patients at the organizational planning level, it's key to know the benefits of why. And so the benefits of learning from lived experience, by understanding families' preferences and needs and using that to help plan services, using that to help develop education and resources, as opposed to us making assumptions or maybe thinking that we know what's best because maybe we are the content experts, but we may not have that lived experience of navigating it, things like diabetes or things like heart disease where they're living with it for 24/7. And so we've learned that by doing this, it actually reduces our assumptions and removes those assumptions. So think about what maybe we have done inadvertently, right? In terms of that, it helps to create efficiencies and improve effectiveness. And sometimes we get some pushback that this is going to take so much longer, but in the end, it actually provides a better outcome. It actually impacts how we prioritize things and focuses our efforts on the needs of patients instead of what the needs of the organization is. And so all to sort of say as an example, having patients on our safety and quality committees in our organization, a governance committee, where they partner with leaders to review safety incidents, so where patients have been harmed in the organization, has shifted the conversation and focused on more things than action plans around recommendations that close gaps in care for patients and families. Whereas before, it was more focused on what organizationally do we need to be doing to help us. And so that has become really important. So I'm going to shift it over to Farah to take the next slide.
Thank you. And so we've heard a lot from Kestari that even though we know that you're a group of highly convinced people that this is important, but it really does put words and tangible ideas as to why this is so critical beyond just engaging the people who were hoping to provide service for. So in addition to the benefits from and outcomes, safety, and other perspectives, this also has very strong roots in a lot of the health literacy models that we refer to and use to set the work that we do. So two examples here for you. Many of you are familiar with the health literate care model. which uses many of the principles of both the chronic care system, where people really are needing to be engaged in their care more to manage their ongoing health needs, as well as the health literacy universal precautions toolkit, and looks at the system in a whole different way and all of the different pieces of how people access healthcare and partner for their own health. And so what we've done here is we've pulled out a few examples of where the engagement for patients is so critical. So right here at the top right, you see shared decision making, which is a part of engaging in care to ensure that the decisions people are making are aligned with their own values and what they're able to do, what they feel is important, which we've talked about as engagement in care. But beyond that, a health literate care model also calls for, underneath that, you can see engaging patients as partners in care and improvement efforts. So not just their own direct care, as well as across, you see in a health literate care system, patients and their families provide feedback that help healthcare systems respond effectively to their evolving needs. So it really is much more than engaging people directly in their care. It really requires partnering at that system level. And if we look at the next slide, the health literate.
Sorry. Sorry about that, Farah.
Oh no, that's okay. Thanks, Kesri. I just worried that it wasn't that you couldn't hear me because that was my experience earlier today. So the health literate organization is also one that we've heard a lot of discussion about, and for us in a hospital, we actually use this as a framework for our health literacy work planning. Hopefully you don't need any more convincing, but just to point out as well that the 10 attributes of a health literate organization also including populations served in the design, implementation, and evaluation of information and services. So basically the idea is that we can't do this without engaging the people that we're serving in our work, in our planning, and our improvement. We need to do it beyond the care that we're delivering to them and really bring them to the table to help set priorities and plan our health literacy work. So with that, we wrap up our convincing session, and we're going to move into how do you do it and how does it work, and provide you some more specific examples of how we've done it at UHN.
Awesome. Yeah, so let's get to it. And so how do we do it? You see a real picture of some of our patient partners within our organization. That's Sean, and the back of the head there is Peter, who really contributed to our organization. So, so how do we engage in a way that achieves true partnership, genuine respect, and meaningful participation? And these are really characteristics that patients and families have told us are important elements to succeed in this type of engagement. And so, what do we do? What does true partnership look like when we've had a patient sit on a search committee and hiring panel for our hospital's new CEO? Or when a new clinic is being designed and how flow of care is being created? So what does that true partnership look like in that context? What do we do to put in place to ensure that respectful dialogue and actions are taking place when patients become members of governance, quality safety committees, boards, those kinds of things, where they're sitting alongside physician leads and executive leadership, where there's clearly a power imbalance? Look like when we're developing an education resource or starting a conference with a patient story? How do we honor that story is that we honor the story and not sensationalize it? And so this might include elements like engaging patients at the start of a project as opposed to when things have been already developed. And I've heard others talk about baking a cake. And so do you engage patients with trying to decide what we're going to bake, or are you going to engage patients with testing it at the end to see if it tastes good? How do we ensure everyone at the table values each other's expertise and truly seeks to learn and understand by active listening, probing deeper to understand their lived experience, and then looking at integrating and that learning into your work? We can hear and listen, but what do we do with that information in the end? And how do we keep patients updated on the work and the developments and the outcome of the projects? These things are simple things, but they're often forgotten and really risk this unique relationship. And so at UHN, we developed what we call a patient partner program. And so these are where patients and families who've had care in the organization can apply to become a partner. They're oriented to their role, and they become a part of a community of patient partners. This group has grown over the last probably 5 years, we have about 115 active participants, and they're matched to different initiatives across the sites. And so when we take a look at how we're doing this, I want to share with you a nice framework because it really helps to sort of situate this work. And the health system in our province of Ontario uses this. So this is from Health Quality Ontario. And it's a specific engagement framework or guide. And so you'll see, if I situate you, that at the very top, you'll see 3 boxes. And this talks about how you can engage patients and caregivers across these 3 domains. So personal care and health decisions, which what we talked about earlier and on in the presentation, but also program and service design. So designing things, and then policy and governance strategy. And so within those different domains, in terms of how you can engage people, the bottom half of this framework really talks about the different ways in which you can do it. And so you could be sharing information, providing easy to understand health information. You could be consulting on a particular issue, asking key questions about a topic that you want to explore, maybe understanding priorities or needs. You might deliberate on a particular issue. And you might collaborate, partner, and work together from the beginning to end on a project. I often sort of give the example to people, when you're struggling to sort of figure out, should we do this or should we use that, this content, or should we plan this particular service in this particular way, and you're back and forth within your own team, it's really highlighting the need to ask patients and to really bring them into the fold around this, because often they'll have very keen and lived experience around that. So the framework pushes us to engage in elements where we've never been or thought of ways of doing it. And often a project will likely call for many of these ways of doing it. So consulting, deliberating, or collaborating. And so as we look at this next slide, you may be able to do different methods of engagement. So this might look like surveys that you might do, and some of you may have done this in the past already. It may look like one-on-one interviews. It may look like focus groups or committees and working groups. And there are others that have evolved in our sense, but these are probably the 4 major ones that we've seen erupt in our organization. And if you haven't tried engaging or partnering in this way before, you may want to try 1 or 2 in a project, but ideally an initiative or a project can call for multiple methods so that more voices and perspectives are included. So I'll give you one quick example that we utilized in the development of our Declaration of Patient Values for our organization. So what was the sort of compass that the organization needed to sort of use to really understand what patients and families valued? So these were things like accountability and compassionate care, respect and dignity, equity and partnership. And I'm sure a lot of these health organizations have similar types of values. And so we had a committee to develop this with members from across our organization that were involved. And it included 2 patient partners who are actually also executive sponsors on this steering committee. We met and attended meetings every other week over the period of the project, which was about 8 months. And they contributed just as an equal partner as every other member. We also, in this project, conducted surveys with a larger group of patients of about 200. And as the project evolved to help get perspectives on things like what did we want these values to be and what were they going to be defined as? So we needed to engage more voices in here. We also conducted one-on-one interviews with patients in the hospital receiving care regarding what they wanted to see around this as well. And so although we had 2 patient partners at that table collaborating in the discussions and all of that going on, we also wanted to bring larger voices that had different care experiences, that maybe had different personal experiences and social experiences in their own lives that would help to navigate that as well. And now in our COVID time, because we've established this culture in the organization, we do continue to engage. We're not doing it in person, but virtually. And so because we've established these relationships ongoing, this engagement and service design in these ways that you see here, that relates to policies related to COVID, we've been able to continue that, but it looks a little bit different. We'll talk more about that a little bit later. So
Kesteri will pull up a video now that will show you, and while she sets it up, I'll just I'll give you the context here and what this is and how it relates to engagement. So the video that we're going to show you is an account from one of our UHN patient partners. Chado he was involved in some work where we really wanted to integrate patient stories into our teach back training to demonstrate the impact of that. And we developed some videos so that it would be more sustainable. So this video that you're about to see includes Chado's story and his perceptions of the care he received, which we use to help provide context to why Teach Back is so important. So as many of you know from the health literacy work you do, you can go through information and instructions and you can be as clear about the steps involved as you can be, but sometimes you just don't know how it's perceived or what those gaps in understanding or interpretation might be. So when you watch Chado's video, give some thought as to how the information here might influence the work that you're doing with patients and how you're doing improvement with them and for them, and also how having this information at the beginning versus at the end might influence things for you. So Kesteri is going to start the video, and just so you know that the first while you see the text, the setup for the video in the situation, it is quiet, and you'll hear the sound start back up again as soon as Chado starts to speak.
just checking, Farah, do you see that on the screen now?
Yes, we do.
Excellent. Okay, here we go.
In the end, I almost didn't make it. And one of the key factors for not making it was my result on the 6-minute test. And I was at a point in my illness where I was so weak that, in that condition, you feel tired, exhausted, and so on. So I really took advantage when they said, well, just be comfortable and take a rest. And I'm sure that I could do more, could have done more, just based on what I do in my everyday things, even just go to the washroom or whatever. After it was over and I realized that it wasn't such a great result, she said, well, it's a test. So, she made it sound like it was a PhD exam or something. You really have to take it seriously. To me, I saw it more as my mobility base. I could still get up, I could still walk and so on, not realizing that the pace and the speed was so critical to get that, passing level time-wise. But she ended up saying that was a critical part, which probably would not have allowed me. But because she knew my history a little bit, I'm athletic, I'm not heavy, I've been active all the time, I had no other diseases and so on. So she, I think, probably took a chance. And that's how I got on. It's only then I realized, wow, had I even just done a little bit more, 10, 20%, would have brought me closer to that passing level for the 6-minute test. Had I been told, listen, it might not feel easy, but as long as it doesn't hurt you and so on, you really need to try as hard as you can, because this is one of the critical tests. They'll determine if you get on that transplant list or not. Now, maybe they implied it, maybe somewhere it was mentioned. I just don't remember it sticking out.
You can see from that account, and we'll ask you to reflect as well what stood out for you from Chado's experience that might help you take a strategy or identify which content to include in health literacy resources or approaches. By learning more about Chato's perceptions and engaging with patients, we can understand some of the gaps for them or some of the background information that we have that people don't necessarily know at the beginning, and it really makes a big difference to engage people from the very start. And so in our work, we've tried to build this in on a regular basis, and what you see in front of you here are a couple of screenshots from what we call our consult tracking form. And so this is a tool that we use to do an intake every time someone approaches us with a resource, and most often it's even if they just are requesting a plain language review, we'll still ask them a lot of these questions to understand the process that they've gone through and ensure that there are no gaps in their content. So we ask, of course, what prompted you for the project? And in this case, it might have to do with creating information about the lung transplant journey, which we know is very confusing. We go through information about patient population and we ask questions beyond just what you see here about their different health topic needs, and more than often just what's in front of us. The one problem or need that's been raised, we'll also ask other questions about what patients might be experiencing or dealing with. We ask people to define their learning objectives from their perspective. So, what do you want people to be able to do by the time they're done reading this resource, taking your program, whatever they're working on, and what do you already know about their learning needs? And then, of course, the fifth question that you see there right at the bottom is, how have you already engaged with patients to learn about their needs? And so very often now, with the change in culture that we see in our organization, people will come to us and they've asked specific questions and they've already done some of this work to engage with patients or families to understand their needs and their perspectives. But oftentimes they haven't yet. And so this is an opportunity where we'll go through how they can engage with patients to understand their needs at a different level. Oftentimes we'll connect them with the patient partnerships program, which Kasari has talked about. And we'll really require this or encourage this as a critical step in developing any content that's for a population as early as possible in the process. And so that's part of how we've built this into our day-to-day work.
Right. So yeah. Oh, are we good, Farah?
Hand over.
Awesome. Okay. So what I wanted to say before, we're going to go into a few slides here around each of those methods or ways of engaging, just to give you a little bit more background and detail on what to consider and when to use these particular issues. And so one thing I don't want to forget to mention is that often, we have a system, we have a group of patients in our system that are ready to go. But what sometimes I do hear from people is that where do I tap into this and who do I ask? And so it is an element to be considered as you do this work, is trying to build relationships in your community, in your organization that will allow you to work with patients and families in this way. So your clients or your community. And so think through that as well. That's a whole other probably hour worth of discussion. But I just do want to acknowledge that is sometimes a challenge for a lot of people. So let's talk about surveys. What I want to do is again, when we're thinking about a particular topic or issue, there may be things. What I want to do is go through and describe to you when these methods are best to use and how to prepare for them, and some considerations to take note of. That allows you to ensure that the engagement, again, is meaningful and respectful and holds true to that partnership piece. So for surveys, this is ideal to use to get systematic feedback from a larger population, really taking a look at what are the opportunities to gain insight into a specific issue or question. And so you want to think about, how is the survey going to be administered? Is it going to be in real time? Is it going to be online? Is it by paper? What secure format online survey platform might you use? And I likely don't need to tell this group, but making sure that there's clear instructions, it's in plain language and easily understandable is really important. But to also discuss some of the ethical issues around implementing a survey, especially when you're implementing it with clients or patients or families that are receiving care. So to ask yourself this question around, how might they perceive being asked to fill something out and provide feedback, and how will that impact how, as a patient, would I say, how is this going to impact my care? And so statements or discussions to sort of say, it's anonymous, please be clear, please be as honest as you can, and it won't affect your care. Just that statement can relieve a little bit of tension in that regard. Always important to make sure that they understand in the survey what the purpose of it is and what the intended outcomes are in the preamble of that. How will my feedback actually be used in the results around this? And as well, you'll see a theme here around follow-up process. So informing our patients of the outcome of the project and how their feedback was used. It could be sharing the themes of the survey, and also how what final decision was made, what was put in place around this. Always important to sort of circle back around that. And then when we talk about focus groups, so this is really, looking at how can we bring together a group of people to share their insights into a particular question or a particular issue. And it also allows you to figure out how do we approach a problem, or how are we identifying a priority area. So really looking at defining, okay, what are we asking people at this table? If we bring 10 or 15 people together, what are we actually asking them to do? Really giving them, again, the purpose, the goals, and the intended outcomes of the focus group ahead of time. And one of the major reasons why, especially in a focus group, of giving background at the start of the focus group, providing some high-level questions to reflect on prior to the focus group, is that you're also managing many people's opinions, perspectives, and so it really allows you to help keep you focused in terms of a mutual goal as a group. And so also identifying who is facilitating this group. So really identifying the role at the start of a focus group around who's the contact expert in the room, who's the facilitator of the discussion, and who's the note taker. And these things really become highly important because everybody wants to be heard, and it allows you to really navigate that as well. And as well, as I said before, the process in place to make sure they see what comes of this project, and how will they be identified and shared the information around the outcome of the decision being made, or the outcome of the work. And then when we look to, one-on-one interviews, you can use this to help identify priority areas for quality improvement, explore a single issue to understand one particular individual's experience. And it also allows you to dig deeper into that experience as opposed to a group, to really use those active listening skills and probe more as you go through. And it leads to opportunities or ideas of other methods of engagement in the future. When we started out some safety work in our organization, I really recommended people starting to sit down and really talk one-on-one with people to help us really understand how do we even approach trying to figure out how to decrease surgical site infections in the organization. So that really helped to sort of guide the way. And again, describing the background and the purpose. And a key element, probably in all of these, but especially in one-on-one interviews where you may not know this person sitting in front of you, is building rapport at the start of the interview. And that comes from just having an informal discussion and starting it out that way so everybody's relaxed in the room. Really talking about what's the theme, providing some high-level questions, and what's the goal that we're trying to do with interviewing you here. And then be prepared to alter your questions and recalibrate directions, as well as for emotional reactions, depending on who you're talking to and the experiences they're shared. That you may have a goal in mind when you sit down, but it could go in a completely different direction based on what surfaces and what may be triggered for people in this. And then again, that follow-up process, right? To stay true to making sure they know what happens in the end around this. And then finally, a working group or a committee. And again, this is used to develop and implement a specific project in collaboration, partnering through the entire quality improvement process from start to finish around this. And I provided a few examples earlier around what that might look like. And again, what are you asking patients or families to do at the table? What is their role? And often our patients are asking that. I'm happy to be at the table, but please tell me what you're expecting from me, because I want to make sure I do a successful job in giving this partnership what it needs. And vice versa, so it becomes a real relationship. Prepare the team that they're sitting down with ahead of time. Not all members of the team or a committee might be ready to have patients at the table. And I would say in our first couple of years, we went through a lot of culture shift around this, to doing lots of education prior to a patient coming to the table to be an equal partner. And we've had some awesome experiences, but we have had some hiccups where people at the table were disrespected because the team wasn't ready. And so we've worked through that, but part of that is really having open discussions with your team members to say, what are the benefits of having a team member here, and what are you concerned about by bringing a patient to the table? And a lot of things that were raised were around things like privacy and confidentiality, or I just don't think patients will understand this work, or they're going to see our dirty laundry. And I'll tell you that our patients and our families know the dirty laundry that goes on, and we can prepare them to have the right discussions at the table as well. A key thing to this is also having an identified staff liaison who's a primary contact person on the committee that acts as a bridge and supports patients and families to integrate into the team. And where hiccups might happen, this person helps to navigate that on both ends. So, are patients helping us in this regard, or are there things that we want to talk to our patients about to make them more successful, or are there members on the team or there situations in the operations of it that may need to be reestablished to help it be successful? We often meet with the chair and the patients prior to their first meeting so that they get well integrated and really understand the shared goals of the committee. And again, throughout the process, having outcomes, understanding the outcomes of the project becomes really important. And often in the beginning, in our beginning years, patients were involved in something and then it ended and then they had no idea what happened to the work. And so we're really keen to make sure that that stays in check for sure. And so, those are just some examples of how those methods can be used. What we want to do is shift a little bit to how have we had to shift with not being able to maybe do all of those things uniquely. We've been having well over, probably 200 engagements happening at a time in our organization. And as soon as COVID started and we had to sort of shift our engagements to virtual, and the hospital shifted towards working towards COVID, a lot of projects were put on hold, but we knew that there was a lot of projects coming up and decisions having to made around COVID itself. So we identified a group of about 20 of our patient partners who could provide rapid fire consultations with us on the changing environment. And Bear's going to talk about that more, but it has been unbelievable. And I can, would probably say the same in terms of all of your experiences if you're working in these health organizations, that things had to change very, very quickly. And we wanted to make sure that our patient partners were involved in those conversations. So we relied on this established relationship that we've had of trust that we created with our patient partners to enable the successful shift of what we had to do. And so it led to that really all patient and family facing communication about COVID became the focus of our immediate attention. And so I'll turn it over to Farah to walk through, and I would just sort of say kudos to Farah and her team in our portfolio, because it has been sort of, especially in the beginning, kind of like a 7-day-a-week, 24/7 kind of piece where her team went into full action around this and has been doing a fab job. So just kudos to you, Farah, as you go into this work.
Oh, thank you, Kessary. Thank you. That's very nice. So, and I think we've been very fortunate to have the portfolio and that infrastructure has really allowed us to be where we need to be and bring people in quite rapidly. So what Kessary and I want to do with the last couple of minutes that we have before we open it up to questions is give you some pretty specific examples of how we've engaged patients and what we've learned. So I apologize for the small font. What you see here is just a shot from our website, because on March 20th, the province declared that visitors were no longer allowed to come to the hospital. And in many cases, that included people who were coming to hospital with support people, and new criteria where people are able to bring in a caregiver or a visitor with them. And so, as you might imagine, this led to a lot of backlash, and especially they were feeling it at the doors and the entrances of the hospital where people were being turned away. And sometimes they weren't accepting the message, and sometimes they didn't know the message. And so this was an opportunity for engagement, both to understand a little bit better what was happening and to also be sure that the messaging that we were delivering was very clear. And in this case, we really didn't have as much opportunity for some of the more the engagement that would help determine what the policy was, because this is what we had to work with, and there was no flexibility. So we needed to ensure that we were sharing information clearly, but there were opportunities for consulting if you think of that framework. So we listened to what was happening through the screeners to understand a little bit more about that experience. And we also paid attention to concerns online that were expressed both through our patient relations program and then also online through forums such as Twitter, which people were really taking to vent their frustrations. And we went to our patient partners to better understand both the situation and then also to get them to review any communications we had to ensure that we were communicating well. And so we'll show you as we read through a bits of feedback we got, also what we did to address that. So we were told that the website was a bit cold, didn't really explain why the no visitor policy was important. The person said, of course, everyone knows it's because of COVID, but I think it might help to remind people that it's to keep the vulnerable patients and the staff that they depend on safe. Someone shared her own experience about the stressful appointments and how unimaginable it would have been for her to be there without a talking about the amenities that we could offer or the services that we could offer, such as a cell phone for people to connect. And we were also told to avoid using the word alone because that is scary. The other thing that was lovely that happened was that while one of our patient partners was providing feedback, they received a call while working on their response. So in the moment, we knew that some of the systems we'd already put in place were working and that the person was reminded that they couldn't bring a caregiver with them.
And Farah, this is Jennifer. I just want to do a quick time check. We have 5 minutes left and we are getting questions in the chat box. So if you can bring it to a close, this is so compelling and I hate to interrupt, but I just want to make sure we have time to get to a couple questions.
Thank you so much, Jennifer. So I'll just wrap up with a couple of screenshots of how we address this, and then we'll go ahead. So what you see here is some of the alternative content that we did put on the site, and so some of the changes that we made. We realized that when we said no visitors, the caregivers and the patients weren't realizing that that spoke to them. They thought visitors were visiting people who were in the hospital as inpatients or overnight. And so we made sure to add content. If you look forward down, you see that there's now direct content that's speaking to this. We created more information on limits on who can enter UHN during the pandemic and why, as well as what they should do and how clear it should be around the process of if they were reaching or searching for an exemption. And in one case for one of our hospitals, we even included verified clinic phone numbers because we'd had feedback about how hard that was. So we also used the feedback we had to verify that parts of the process were working and just to really look at the language and some of the messaging we had that we thought was clear and was coming across as colder and feeling. And so this is just one example of how we've learned from and really changed our structures for patients. And I think more important than this, we've also taken some of that feedback and we're working with the hospital to try to understand how we can continue to work on visitors policies within the confines that we have in our province. So that wraps that. We had another example to provide, but I think given the time, we'll just go straight into questions.
Yeah, that sounds
Wonderful. Thank you so much. And again, as a reminder, and in the chat box, I've posted the link to the Health Literacy Solutions website where you'll be able to view that additional example. This entire recording will be posted. We are getting some excellent questions. One from Kathy Leslie. Could you talk about how or if you've established a culturally and linguistically diverse group of patients in your engagement efforts? And do you hold focus groups with patients who do not speak English well enough to participate in English?
That's a great question, and certainly, it's right now in terms of our group, our patient partner group. I would say that we have a diverse group, but probably not enough of a diverse group. So we currently don't have any patient partners in our group that where English is their like they don't speak English. So we have folks that speak multiple languages, but not that in regard. But we have in our organization our translation and interpretation services. And so we did start to develop a process where, as we started to bring in patient partners in this regard who didn't speak English as a first language, a process for them to be able to engage with us and have an interpreter present at the same time. The other element to this as well is that one of our sites has a large Chinese population, our Toronto Western site, and FAIR is has been involved in this particular group, and also provides interpretation of some of the health information talks that the patient education and engagement team puts on, where there's interpretation around that. So those elements are there. I haven't run a focus group with that interpretation in place. FAIR, you may have done that. I'm not quite sure. But one of the elements around this as well is that is it a different type of engagement that we're embarking on, where we're actually starting to look at how do we go outside our walls and into the community around asking people's perspectives around that, into communities where, English isn't the first language, or other experiences doesn't allow them to actually come in or feel safe to come to our hospitals, where it's easier for us to go out as opposed to them coming into our walls, where it might be scary or just not having the trust there. So
Right.
yeah.
Well, I wanted to just post, thank you for that. And it's a complex question. Great question and complex answer. And this next one, I just want to squeeze one more in very quickly. I know we're at time. If you can answer it yes or no, but Jerry Lynn is asking, do you usually video record the focus groups and interviews, either for note-taking purposes and or sharing later with staff?
For the most part, it has been no, but there have been requests to do that. And our approach to that is really asking patients' permission.
Sure. Okay, excellent. Well, thank you. Thank you to the audience. Thank you both, Farah and Kesari, for a wonderful, informed, info-packed presentation today. We've mentioned several times the recording will be available on the Health Literacy Solutions Center webinar archives. You will receive an email containing a link to the eval form if you requested CEUs. Your response to the survey is required in order to receive those. And as you know, we try to schedule webinars once a month, so keep an eye on the Health Literacy Solutions Center website for details on upcoming webinars. Thank you again to our speakers and to everyone who joined today. Stay safe and have a good day.